Hi, everybody. My name is Angie Peacock. I'm on the Medicating Normal team. I was trained as a social worker and a therapist, but I was also harmed by the treatment I got in the mental health care system. I also volunteer doing outreach for the film, and I host conversations like this one. Today is our 41st interview, and our guest is Dr. Kendra Campbell of Free Range Psychiatry. Dr. Campbell is a holistic psychiatrist who is passionate about bringing awareness of the harm caused by medicating the human experience. She founded the nonprofit organization Free Range Psychiatry to empower people to heal disease through connecting to their inner wisdom. She also founded the Free Range Fellowship to educate healers about holistic psychiatry and the mind-body connection. Welcome, Dr. Campbell. I'm so excited to talk to you today.
I know, I am really excited.
Yeah, and as you can see, we're both in an RV. We both live in RVs, which is the coolest. We haven't even had a chance to really talk about it, but you get to see the back of an RV through this conversation. I'm so excited about it. All right, so I want to share really quick about how we met Dr. Campbell. She probably doesn't know this, but we did a screening in Williamsburg, Virginia. And I Googled holistic psychiatrist within like a 250-mile radius. So way back then, I invited you to a screening, but I probably went to junk mail or something. I don't know. But then I just was persistent, and I thought, I got to meet this person because their practice looks perfect. Like I'm totally in line with everything that they had on their website. So sure enough, we got a hold of her, and she was so gracious to help us be a panelist on a few screenings so far. So she is on our YouTube channel already, but we haven't had this one-to-one conversation. So that is what I'm looking forward to today.
Yeah, I'm totally psyched. And no, I didn't know that story. So that's pretty rad. And it had to go in my junk because I know if I would have read it, I definitely would have come.
You would have been there.
So but I know. The universe unfolds in mysterious ways. So here we are.
That's it. So let's start off with kind of like what brought you into psychiatry, more importantly, what brought you to holistic psychiatry?
Yes. Okay. So I'm going to try to make, of course, what is a very long story, relatively short. So let's see. When I was growing up, both as a child and as a teenager, I had my own mental health struggles. I actually was involuntarily hospitalized at one point. I was given psychiatric medications. I had various diagnoses thrown at me. So I kind of had that background. And then I was as I was going into undergrad, I decided probably because I had that background to get a bachelor's degree in psychology. And when I graduated, I was like, well, what do I do now? And I found this really amazing job working at a state psychiatric hospital in Virginia. And I was essentially a psychiatric technician. So kind of like working under the nurses. So my job was basically to hang out with the patients all day and talk to them, spend time with them, like have fun with them. Like that was kind of my job. And I remember thinking like, sitting down and talking with them, basically just kind of like treating them as a human being and seeing like how they responded to that. And then I would see the psychiatrist come in and spend like 15, to 30 seconds with them and then decide to make some medication changes. And I saw what that did. And I noticed that, it seemed to me like my interactions were kind of more healing on some level, more therapeutic. And I saw like, all the negative effects of the medication. And I saw like just what was not happening with the psychiatrist. And I thought, this is weird. Maybe I have something here. But then I also thought, but you know what? I probably just don't know what I'm talking about. I'm not a doctor. There's probably something that I'm just missing. I just don't know enough. So that was kind of the big impetus for me to go to med school. So I decided to become a doctor, went to med school. After that, I did decide to go into psychiatry. So I did my fellowship. I did a residency and then I did a fellowship. And, long story short, I would say that while I wasn't like 100% kind of brainwashed by the system, I definitely it sold me a little bit, And so when I was finished and I graduated, I did practice like regular traditional psychiatry. So I was actually working in an emergency room, prescribing medication, seeing people like that. And then I guess it was probably there that I just started to realize, again, I just had this feeling kind of come back to me like, wait a second, like, I'm doing this, but I'm seeing the same people over and over. The medications don't really seem to be helping. The hospitalizations don't really seem to be helping. Like none of this seems to be working. And that's kind of when I started to think back to like, I guess why I went. And I was like, wait a second, like I kind of came into this field thinking this, but I had to really think, far back to that beginning. And then long story short, my own mental and physical health was really bad when I was working in the emergency room. I got to the point where I was actually having like suicidal thoughts. I remember like, standing on a busy New York City street, like literally kind of thinking about even like walking into traffic. Like I was burnt out. I was on probably like, I don't even know how many medications, lots of different medications. I had all these physical problems. And I went to my doctor, and I had for a long time wanted to have a child, but I always assumed because I had all these medical problems and stuff, like I couldn't. And my doctor basically said, I think if you quit your job and just kind of like focused on your health, you could probably have kids. You could probably get pregnant. So I decided basically at that point to just completely radically alter my life. So I changed my diet. I started doing, exercising more regularly, tried meditation and yoga, and just made like really, really drastic changes. And over the period of really, it was pretty quick, over a couple of months, all of my physical health problems disappeared. My mental health was like wonderful. I was able to taper off all the medications that I was on, and literally just found like this amazing new radical perspective on life. And I basically decided then to quit my job. I moved to Virginia. And that's when I decided to basically, I educated myself because there is not a lot out there. So I read all these books. I went to all these classes. I did all these seminars to learn basically holistic psychiatry and all this stuff that I didn't learn in medical school and residency. And because basically, I was inspired by what happened to me, and thinking this could work for other people. And that I think that's it. I think that's basically where we're at today. And I founded Free Range, and that's kind of how I got into it.
That is awesome. Wow. I love that story, just because I hear this thread of like intuition, that there was something not sitting in you, correct, and you kind of listen to that. And I always find when I ask guests that come on, like, what was your turning point? It's always, there was something that just didn't sit right with me. And so you had it too. It's amazing. It's amazing. All right. Absolutely. So that leads us to Free Range Psychiatry. So kind of like, tell us like, what is Free Range Psychiatry? What are you guys all about? And like, what kind of offerings do you have?
Sure. So I started a Free Range Psychiatry back in, that was about 2017. And my idea in the beginning was basically to provide, I like the word, I think holistic kind of encapsulates it the most. Holistic treatment, meaning not just medication, but all of the other things to people. And when I first started, I actually did house calls and virtual telemedicine visits, and had like an office. And eventually now we're doing 100% virtual, at least for the time being. But the idea was to provide this alternative type of psychiatry to people. I didn't realize though, when I first started, that my niche would actually eventually become getting people off of psychiatric medications. I actually thought more of my patients were going to be people who had never taken a psychiatric med and just wanted to kind of do this, but that ended up not really being the case. Most of the people that found me were people that had been on psych meds usually for a long period of time, many years, and were usually, very much suffering, sometimes very disabled by the medication, and many times they had tried on multiple occasions to come off the medications. Of course, many doctors and psychiatrists had told them, no way, it's not possible, you'll never do it. And that's who I ended up kind of seeing. And so that kind of became what we specialize in. So it's now myself, and at this moment in time, 4 other holistic psychiatrists. We also have like a cosmic coordinator and some volunteers and some other people that are part of the organization. But what we do right now is we see patients in, I think, about 20 different states right now, but we're kind of always growing and expanding. And we do telemedicine virtual visits. And we see folks and basically help them help them get to the root, the actual kind of root cause of what's going on, and use all these different types of holistic treatments, which I can talk about, but to essentially help them get off medication, which most people are able to do. So we are a nonprofit organization. So in addition to seeing patients too, there is a component of our mission, which is kind of education based. So we try to do a lot of just really educating the public and everybody else about this topic, which I'm so passionate about, like just the topic of, what really just the state of affairs of mental health in this world, and psychiatry and psychiatric medications, and what they can do, like, really telling people the full story of what psychiatric medications are and what they can do, what the potential effects are, what happens when you try to come off these medications, and then like, what is the alternative, right? Because the narrative that I feel like is being sold by traditional psychiatry is that, if you're having a mental health symptom, you have a mental health disorder, you have a diagnosis. And for that diagnosis, there is a pill. And maybe you might even get some therapy too, but that's about it. That's kind of it. And I think that's like totally, absolutely wrong. Like from the foundation, like I actually don't even really believe that, I don't even believe in the diagnostic model, honestly, like the DSM or anything like that. I'm going off on the tangent here. Anyway,
I am enjoying this.
So,
go.
Yeah. So a lot of it is just like screaming this, getting this message out there is a big part of our mission. Providing the care to people and helping people is another kind of arm of that. And then another thing that I'm really passionate about is when I started this, like, as I mentioned, I was like, okay, where do I get this training? Who do I talk to? Let me find all these holistic psychiatrists out there. And then it was, crickets, because there are not very many people doing this. And so my part of the mission of the organization also at that point became, we got to find other people out there who are kind of at least a little bit interested, other healthcare practitioners, psychiatrists, nurse practitioners, and people like that who want to learn this. And we need to educate. I want to provide them education. I want to teach other people to do this. And so that's when we developed the free range fellowship. So that's that. And then we have also all kinds of other programs. Like we have like some virtual support groups that we do. And we're constantly kind of growing and expanding. Like I myself am a yoga teacher, so I'm soon going to be releasing like hopefully a whole bunch of cool yoga videos and stuff like that for the public. And yeah, I could talk for hours about the many things that we have kind of coming up, but I think that's kind of a good description of where we are right now.
Awesome. Wow. So much to talk about there. It's like, I don't know which direction to take, but I'm going to pull that thread of kind of like the traditional model. But this is what I want to, because recently I've come across this thing that has been like simmering in me, that all these people are saying, like, got to take care of your mental health. You got to do self-care. You have to do that. And it seems like everything is boiled down to this mental health problem. And it's like, no, that's your life. Like your communication with your loved ones, building community, having meaning in your life, your nutrition, all of that is your health. Like it's not just mental health. You know what I'm saying? So can you maybe talk about some of the critiques that you have with the current way we do things? Like go a little bit in depth about the meds, the chemical imbalance theory, whatever you want to talk about, but like kind of what is wrong with the way we're doing things.
Yeah, this is so hard to boil down because this is something I could talk to you for like 7 to 10 hours about.
Look, we have 45 minutes, so take time.
Okay, so what is wrong? I think everything is wrong with the current state of allopathic Western mainstream medicine, and not just psychiatry. I mean medicine. I mean healthcare. I mean the pharmaceutical industry, the entire system. It is reductionistic. And it is, we split everything into these little silos, just like you said, oh, mental health is over here. And you go see a podiatrist for your foot and you go to over here for this. And it's all very kind of siloed. And it's also very kind of like, when I say reductionistic, I mean, so like to give you an example, it would be like if you walk into a psychiatrist and you say, okay, I'm feeling a little anxious. And so they just narrow in and say, oh, okay, anxiety. That means you have anxiety disorder. Here, take anxiety medication. But But what they didn't ask you is like that, they didn't ask about the fact that your mother died like 1 week ago and you're going through a divorce and your dog is sick. And so, it's so much more than that one little symptom. I've probably said this before, but my favorite analogy to use is kind of this analogy of like, you're driving your car and you see the check engine light come on. And so that's the equivalent of like your body, like, you're feeling anxious or your toe hurts or you're having a headache, right? So your body is giving you this signal, like check engine. So if you just go and you just kind of take a pill and say, I'm going to take a medication to stop that symptom, right? It would be the equivalent of taking duct tape and putting it like over the check engine light, right? So now it's like, oh, I can't see the check engine light anymore. So everything's okay. So that's kind of what the pill does to mask it, right? So not only did you not fix the problem, but guess what happens when you like just cover it with duct tape? It doesn't get better. It gets worse, right? And so things are just going to get worse and worse until like, your car breaks down or whatever else. And so the interesting thing is that sort of what I've learned in the holistic model is that it's about sorry, I lost my train of thought there. Instead of it being like, you actually ask, in other words, what is the underlying problem? Like, what is it that's actually like, why did the check engine light go off? And the way that, when I think about like holistic, it's kind of like thinking, I like the term of just kind of like body, mind, and spirit. So the idea is that, we all are kind of body, mind, and spirit. And if you just focus on one little aspect and ignore the other two, it's never actually going to work because you're all three things. So the chemical imbalance story, right? So this is essentially a story that has been told essentially by the pharmaceutical industry, or the ones that were really kind of pushing this, saying that mental illness is due to some imbalance, your serotonin or some other neurotransmitter is up or down. You have a chemical imbalance. And then if you take this pill, it's going to correct that chemical imbalance. So this was maybe one of the most brilliant marketing schemes of all time. Like, I mean, how brilliant is it to say like, you are broken. It's not your fault. You have this problem. It's a biological problem. And guess what? We have the solution. And the solution is it's so simple. You just take a little pill. You take a pill every day and it just goes away. I mean, that is essentially like the most brilliant marketing that I can think of. The problem is it's total lie. It's total bullshit. So the chemical imbalance theory is it's completely, we now know, I mean, there's no study there's been a lot of studies that tried to prove this, but no one's ever been able to prove it. And that's because it doesn't work. And the logic is so funny because how they sold it is they said, well, this medication affects serotonin. And if you take it and you're like less depressed, then serotonin must be the issue that's total kind of backwards logic, right? So it turns out that it's complete nonsense. It doesn't work. And in fact, these medications have, not only do they not fix some underlying problem, the effects or side effects, which by the way, they're all effects, right? The side effect or effect, or it's kind of all an effect, but they actually cause chemical imbalances. Right. So when you take a medication, for example, to block dopamine, or to block, let's say dopamine is a good example. If you're trying to like block the dopamine, what happens is your body and your brain is this beautiful, wonderful, miraculous has this thing called homeostasis, right? Where if you put something in, your body tries to adapt. So what will happen is, for example, more dopamine receptors will come out. And now that you have all these extra dopamine receptors, now you do have a chemical imbalance, right? Now you are starting to mess with the body. And so again, not only do they not cure them, it causes it. So now that you have, and it's not just the neurotransmitters that medications affect. So when you take a pill, it goes in your body and it's absorbed into your bloodstream and then gets distributed. So the pharmaceutical industry and doctors like to sell this kind of myth that, oh, it's just going to go in and affect your serotonin and that's it. That's not how the body works. Yeah, no, it's not like a little surgeon that just goes right to one receptor. No, it affects your entire body, which is why you have GI side effects, which is why you have weight gain, sexual problems, neurological problems, all these different problems, because it's not just affecting one little thing, it's affecting your entire body. And it has lots of toxic effects that, again, they're not telling people when they're starting people on these medications. So yeah, I think I'll stop there.
Covered it. No, we had some comments. Everybody's loving this conversation, and they, like, somebody said I could listen to them for hours, or listen to you for hours, because it's like so engaging, and like it's like hearing, like, being validated, because you're saying like what we know as patients, but we had to find out the hard way, but our doctors still don't believe us because they believe in that still, so yeah, thank you for that. Okay, so I guess I want to ask now, like, since you're a practicing psychiatrist and you've seen the difference of like practicing the old way and kind of practicing your way, can you take us through like some of the harms that you've seen, but also some of like the healing that you've seen?
Sure. Okay. So some of the harms. So, I mean, how long is that list? It is so long. So many things that psychiatric medications do. So I've talked a little bit here about the biological effects. So, it causes, addiction and dependence. It completely wrecks your endocrine system, your gastrointestinal system, your nervous system. I mean, it biologically, it's like almost like a bomb going off. Like, there's so many things that it does, but it's not just that. Right. So psychiatric medications, they change your way of perceiving the world. Right. I best describe it as a disconnection. So psychiatric medications will disconnect you from everything. So they disconnect you from yourself. So remember, you were talking about like that intuition, that kind of like that little seed or whatever. So what I've noticed is that when people take psychiatric medications, it like completely disconnects that circuit. So it's like that level, that intuition, that ability to follow that kind of gut instinct is gone. Which is brilliant, by the way, because now you don't hear that little voice that's saying, wait a second, something's wrong. And instead you can listen to the doctor, right? Who knows best? You don't know best. You don't know your body. You have to listen to the doctor, but the medication is actually facilitating that, right? Because you are in fact disconnected. Wow. It also disconnects you, I would say, from your spirit. Like, I believe there is like this kind of spiritual disconnection. Like, it's very, very difficult to, this is, what I've heard from hundreds of different patients, to really feel connected to the divine or greater, whatever you want to say. Like when you're on psychiatric medications, it tends to very often disconnects people from their friends. It can disconnect you from your family. It can disconnect you from your community. I mean, like total kind of isolation. And if you think about that again, like, so now you have this person, you came in with some sort of problem in the beginning. So you were probably having something, and maybe something wasn't going well. And now you've completely done exactly the opposite. So, when you're feeling whatever these symptoms, these are signs from your body, basically, that you need to get reconnected somewhere. But instead, now you're taking this pill, which disconnects you. So not only does it not help, it literally just, most of the time can make everything much, much worse. So that's, I guess, like you were asking about maybe some of the harms, and I could go on forever about that, but those are some of the ones that I think are really big. And now, I guess, to use the connection kind of approach, if you think about how I think about what holistic psychiatry is, or holistic, I don't even like calling it holistic psychiatry, really, as much as just holistic. It's just being human, like human health is almost a better way of kind of saying it, or human being alive. Anyway, is that it's all about connection. So it's all about reestablishing that connection to yourself, reestablishing that connection to spirit or divine, reestablishing your connection to your friends and to your life and to everything. Yeah. And so, for example, do you want me to talk about maybe some of the things that we would do for somebody, or?
Yeah, well, because you're perfectly describing my life on meds. Like, literally, I've never heard anybody explain it like that, but it really is like you become this isolated thing that really doesn't have a lot of feelings. You don't have a lot of connection, but also that is taken as evidence, see, that you're really mentally ill. And that's like the gaslighting that is layered upon. So then you become convinced okay, well, these people are telling me I'm really mentally ill and I can't, and it's true. I can't function. I don't have friends. I'm not seeing, I'm not sexually active, and I should be when I'm, 25. That's exactly my experience, what you just described. But then that extra layer of like, see, this is why you need the system to help you.
Oh,
so yes. So now take us to the next step, I guess. Yeah.
And I just wanted to say, yes, I mean, that's exactly it. It's a self-fulfilling prophecy, right? Like it's exactly what it is. Like but yeah, so I guess, so some of the things, just to talk about some of the things then that we might do. So like, in the holistic model, we kind of really, I think the most important thing is, so I kind of have to just kind of step back to kind of what I like the word disease or dis-ease. I like to call it that because it kind of describes what it is, right? It's something that's kind of not going right. So the question is then, what causes it, right? And it's, I can't say that I completely know the answer to this question, but based on my experience and everything I know, I think that what really is at the core of most symptoms, most dis-ease, tends to be some sort of blockage of emotion. And that blockage of emotion frequently is related to some sort of trauma. And when I use the word trauma, I like to say like big T or little t. So it could be a large trauma, like, a motor vehicle accident or abuse or something like that. Sure, that's one type of trauma. But then there's a million types of little traumas, like a mother who herself was depressed and so wasn't giving you, necessarily all the love that you needed, or even just like a teacher who kind of berated you about something. Like all these things are traumatic experiences that frequently get stuck, kind of in our energetically stuck is how I like to describe it. Emotion is there, and it gets stuck, and when it doesn't get processed, it causes, basically ends up causing this kind of ripple effect through your body, mind, and spirit, this like kind of stuck thing. And eventually it tends to manifest, or it can manifest on that physical biological level. So a headache, or your toe pain, or anxiety, or insomnia, or one of a million reasons that you might go to a doctor. So instead of saying, okay, so I guess a good way to describe is, so if I had, again, like foot pain and I went to see a regular doctor, they would say, okay, take this pill for your pain or whatever, and that would probably be it. A holistic approach would be like, okay, so what is your body trying to say here? So the idea is that symptoms aren't things to just be eradicated. They are windows. They're opportunities. It's your body speaking to you. It's your mind and your spirit speaking actually through your body to say, wait a second, like this is what's really going on. And it may sound crazy to some people that, like, a headache could be related to something that happened when you were 2 years old, that never got processed. But that's what I've seen. Like this is the type of stuff that I see. And I see that when that energy gets unstuck, when that energy, so emotion, the derivation of the word is actually energy in motion, which I think is so cool, right? Emotion, energy in motion. So once you allow that energy to move, once you unstick that energy, and allow that emotion to get transmuted and processed and expressed, the energy flows. And in my experience, whatever that symptom may be, the headache or the anxiety or the whatever, it goes away, because now that energy has moved. I don't know if I'm making sense here, but
yes, you are. Well, only because I attended a whole year of somatic experiencing training. So it was all about like, there's this trauma that's not, like, here's an example. Like, I saw this video where there was a war vet and a bomb had gone off really close to him. And so he developed this tic. And Peter Levine of somatic experiencing was saying, like, the reason he has a tic is because his body is like stuck in that movement. And you can see it every day. Like if you get in a car accident on the left side, you're always like really cautious. Like your body remembers that, you know what I mean? If somebody raises their voice, I feel myself shrinking because my dad did that when I was a kid. There's all these like, hello, it's there, it's in your, and you might not notice because you're not like honed that skill yet, but it's everywhere. If you just look around, there's all these ways that your body kind of keeps it, and it's in there. And I don't not quite sure, because like I'm not a fan of like talking about it, because I don't think talking really like gets to the root of it. But that's why I studied SE, because it's more about like moving that through and feeling like what is it feeling like in your body, all that stuff. So yes, I'm a fan of all that. Yeah. So how do you unstick those? from your perspective though?
Yeah, so it's just like you said. So there are different ways, and regular psychotherapy is one of them, but I don't think I agree with you. I don't see that it's all that it can be some helpful for some people in some way. So, but I don't think it works super well. So there's hundreds of different ways. So like somatic experiencing, or all the different types of somatic therapies are one of them. I mean, there's everything from different specific types of yoga, specific types of energy using, working with the chakras. There is actually this really awesome lady named Eileen McCusick, and she uses tuning forks, which is like crazy, but she literally uses like tuning forks to move like energy stuck in like your biofield. So the biofield is like the energy that you're having on your body. So there's lots and lots and lots of different ways to do that. But essentially, I think that, the most important thing is kind of, and this is just the shift, right? The shift in thinking. Instead of like, again, like I have a symptom, anxiety, I'm feeling anxious. Like the old model, again, the traditional model is I need to do something to get rid of the anxiety, right? So this is a huge shift, right? And I don't do it. I've been doing this for a while, and I still forget sometimes, right? Like I'll still have something, and I'm like, I have a headache, and I'm like, oh, what can I do to take, And so it's a complete, radically different way of thinking about the world. And so instead, like I'm like, okay, I'm feeling anxious. Okay, let me like kind of pause here for a moment. And like start, I like to call it kind of bringing non-judgmental awareness to it. So it's not like judgmental, not like, okay, what's wrong with me? Why am I feeling anxious? No, it's just like, curious. I'm feeling like, yeah, I'm feeling this anxiety. I'm feeling it in my chest. Okay, I'm just want to, I'm curious about this. Where is this coming from? And then just really being curious about it and kind of asking the question of why? Why could this be coming up? Why now? Why am I feeling anxious just right now? What may have happened that may have triggered it? What's going on right now? Like, oh, I just saw whatever, somebody go by with a red shirt, and oh, that's interesting because I had this trauma where somebody was wearing a red shirt. Just kind of starting to kind of think about it in that way is so different than, okay, I got to get rid of the anxiety. And I get it. I mean, that's the culture that we're in. Is you have something, you should get rid of it as quickly as possible, easy solution. So I don't ever want to say, or ever want to come off that like I would ever blame somebody for wanting the quick fix, by the way. Like, trust me, I am guilty myself of using quick fixes all the time. But that's just the culture, that how our culture is set up. It tells us that that's how it should be. Everything should be a quick fix. Everything needs to be easily taken away, instead of like the more difficult path, which is to really sit with it and think about it. Like, it's not an easy path at all. It's not an easy thing to do.
Yeah, I've often thought they're both hard. It's hard to get the easy fix because it's going to show up later. Like for me, it was like kicking the can down the road. You can take medicine for 15 years and not address your root problems. But guess what? It's just like when you get drunk and on Saturday night and you wake up Sunday with a hangover. It's still there. It didn't go anywhere. And now you have to work on it 15 years later. So yes, I totally agree with that. So let's shift a little bit toward deprescribing and tapering off and harm reduction, because when I heard you talk on one of our panels and you actually knew what you were talking about, I was like, oh my God, because we meet a lot of psychiatrists and they try to taper people off and they have their ideas about that. It's in their own clinical judgment, what they think is appropriate, all that kind of stuff. But you have a very, I think, the most in tune with the layperson withdrawal community. So I'm talking about all these support groups that have formed all over Facebook. There's a Cymbalta group, Effexor, Zoloft, all these people trying to get off meds by themselves because their doctor won't help them, which is a freaking crime against humanity, if you ask me. But anyway, so your ideas about tapering and withdrawal and harm reduction are like the closest that I've ever seen. So can you tell me, like, how did you learn these? What is your philosophy? And kind of what have you seen?
Absolutely. And yeah, so I'll just say this. So in my medical education, my, going to med school and residency, I received, I would say maybe zero, maybe a few minutes or something, education about medication withdrawal, about how to safely taper. Like, that was pretty much absent. And I've spoken to a lot of psychiatrists and physicians out there, and I would say that that's the norm. There are a handful of people who I've talked to who said, yeah, I got like a lecture or two, or they got some training, but it's essentially completely absent, which, by the way, is no coincidence, I think. But anyway, because not to get too off on a tangent, but the pharmaceutical industry essentially is helping to fund our medical education system. So we can't be surprised when this is how things kind of end up. This is the education we got. The education that I received was how to prescribe medication. I was told that that was my job. So when I started when I started the idea of, okay, let's do this kind of tapering, I mean, the first thing I did was I tried to read everything that was out there. Which again wasn't very much, but I still read. I know Peter Bregan had a book. I read what is actually available. And then I actually went on those forums. So I started reading like what was going on with people. I was reading about how people were opening up their capsules and counting them and measuring them and crushing stuff, and what types of experiences they were having, what happened during that withdrawal period, and also like what did they do to get through those withdrawal symptoms, like what kinds of things did people try. And I just did kind of a lot of research into that. And then the rest, I would say, has just been that I have learned. I mean, it's just a process of doing. Like, and I think that's probably the most important thing, is that every time I have somebody in front of me, it is, I know that they are a unique human being with a unique history, psychological history, spiritual, biological, and everything like that. So while I love using kind of like protocols and I love using whatever, I also realize you can't. It's every single person, it's a different call, right? So when I know that somebody's been on, Lexapro for 6 months, it's very different than if they had been on, Cymbalta for 10 years. Like, you know what I mean? Like, so it's the type of medication matters, how long they've been on it matters. But then the other thing that I found that matters a lot too is just what's going on with that person biologically, spiritually, and mentally when they're coming into this process of withdrawal, when they're ready to start this process. Because people are all over the place. Like, especially in their healing journey, they literally may have just not started it. Like, they just kind of woke up and decided this is what they're going to do, but they haven't done much. Or there may be people who have been trying for 5 years and they've already changed their diet and they're starting to do some yoga and whatever. So people are very different. I would say that probably really the most important thing that I try to keep in mind when it comes to and I think this is why I've been pretty successful doing it, is the idea that there are these underlying things that are always going to come up. And so I always talk to people, generally my approach is actually that I tell people, which they don't like to hear usually, but I say, we're probably not going to make any medication changes for a month, which I know sounds like a long time for some people. Some people, they can handle it. But I like to kind of start the stuff. Like, let's start looking at what you're eating, and let's look at this, and let's look at that, and let's learn some meditation techniques and some breathing, because shit gets hard once you start making those changes. And so it's my belief that if you get your body, mind, and spirit into as good of a place as possible before you actually start the taper, you're probably going to be a lot more successful. So that's probably my biggest kind of golden rule. And then my second thing would be just go really slow, which I know is really hard, especially when you're on lots of different medications or high dosages of medications. But I'll just tell you my general approach is that I usually only like to make one medication change per month, essentially. So let's say if somebody's on 4 different medications, I'm not going to at one time, I would never change more than one at a time, because then you don't know what's doing what. So always change one thing at a time. And I usually like to wait about a month in between each change. As far as how big of a change, I don't have any set protocol. Like, I know some people recommend 10% or this or that. My experience has just been like to go slow, and to remember that when you're at the higher dosages, you can make larger changes, right? So you might be able to go from Zoloft 200 to Zoloft 175, and most people can tolerate that. That's most people. However, when you get down to Zoloft 25, that last little bit from 25 to 0 is going to be a bitch. That's where it can get really hard. And I'm sure maybe anyone who's gone through this process will probably be going, oh yeah, I know exactly what she's talking about. So my approach is to always keep that in mind. And then really just kind of support the person, just supporting each person in their super unique journey and helping them make sure that they have as much support as they can for this process. That most people going through this have had psychiatrists turned away from them. Their other doctors have turned away from them. Many times their family, they're telling them, oh, this is a bad idea, you shouldn't do this. Their friend is telling them, their coworkers, everyone. And so they're very, very alone. So having as much support as possible, wherever you can get it, I think is also probably one of the most important things I would say during the whole like tapering process.
Totally agree with you. Yeah, I did not go out. I'll just say this for the audience. Like, I didn't go out thinking I'm going to come off all my meds. Like, that wasn't even a goal, like, at all. And I originally had just said, like, do I really need to be on 8? Like, that seems excessive to me, you know? So I did work with doctors, but the whole process, it took me 10 years from the time I tapered the first one till I was completely off. So, you know, I really like that. Last week we had Dr. Swapnil Gupta, who I think is one of your classmates. Was she a classmate?
Yeah, from residency. Yeah, we did residency together. Yeah.
That's amazing. So she was on last week and I read her whole book, Deprescribing in Psychiatry. And it really even though I've been through it, it really gave me like perspective on how much it takes to go through this. It's not like kind of like you're saying, like your support system, your diet, your nutrition, your coping skills, you know, your community support. Like, it's not just a thing that people just jump into and it happens in a year and you're good to go and you're healed and you're back to how you came in. Like, it is. And to me, I'm 6 years off and I feel like I barely have like scratched the surface of my own healing. And I'm going to bring that in later when we get to a different question. But yeah, it's not an overnight process at all. So I really appreciate that you know that and that you see that, you know. Yeah. So let's move. Yeah, go ahead if you want to say anything. You want to say anything about that? Oh wait, we have a lag. Uh-oh. We have, can you hear me? Uh-oh, either she froze or I froze. I'm not sure which one of us. Uh-oh. Can you all hear me talking? I'm not sure. Kendra maybe lost her internet. Can you hear me? Okay, Val can hear me. Okay, thank you, Val. So I think Kendra, are you back? I think I see you now.
Can you hear me now?
Yes, I can. Yes, I can. Woo! Can you hear me? Kendra's frozen. Okay, Ryan can hear me. I'm sure it's so. When you live in an RV or a van, the Wi-Fi situation is serious. Can you hear me, Kendra? I can see you moving a little bit.
Can you hear me now?
Yeah, it's just the Wi-Fi. It's bad. Can you hear me? I
can hear you. Can you hear me?
Perfect. Yes, it's your Wi-Fi because everybody says they can see and hear me. It's your Wi-Fi. But I explained.
I have 3 different networks. I just switched over to network 2.
Oh my God. I have one network and it's just this little phone and I understand. I told them the RV life is hard to get Wi-Fi. It's a very difficult thing. It's okay. Okay, so let's pick back up with kind of the fellowship. I want to, this is for my own curiosity's sake. Like, why do you think the psychiatric like guild, the profession in the US is very behind on this whole deprescribing thing? Like, what is going on? Why is it taking them so long to catch on? I mean, I already probably know the answer to this, but from your perspective, why are they not getting it?
Yeah, I think there's 2 reasons. And actually the second reason just occurred to me yesterday when I was talking to like a traditional psychiatrist. We kind of got into a little bit of a thing and it occurred to me what was going on in their mind. And it all kind of was clear to me. Number one would be the thing that I kind of already mentioned, which is that the pharmaceutical industry is funding our educational system. So any time that you have a financial, desire on one side, like it's always going to be an issue. So I think as long as big pharma has this much of an influence in our medical education system and our healthcare system and everything, by the way, they have their fingers kind of in almost everything. There's always going to be this, right? We're always going to be struggling with fighting against their narrative that they're pushing. The biological chemical imbalance, take this pill model, right, is always going to be. And so they don't like to talk about that, right? They even came up with a different word, right? It's medication discontinuation syndrome, right? Like it's not withdrawal, it's not addiction, it's not dependence, right? So, they're always going to be pushing this narrative. And so as long as that happens, I think psychiatrists are not going to be getting, and other doctors are not going to be getting the education that they really need about this. But then the second thing occurred to me when I was having the discussion yesterday with an ex-colleague or a colleague of mine, and it came up that I realized that it's also, you know, us doctors and psychiatrists, I spent a lot of money and a lot of years of my life pursuing this profession, learning what I learned, right? So to be able to say, to be able to actually even start thinking about this whole medication withdrawal, and maybe that medications could be harmful, and thinking about this at all, requires me to kind of say that I wasted a lot of time and money. I wasted years of my life. People don't have, you know, put off having a family. They sacrifice spending time with their loved one, like all these things that they sacrificed, and all this money that they spent, and they don't want it to be in, what's the word I'm trying to think of? Yeah, they just don't want to have wasted all that. So I think they cling so tightly to that, and this idea that medications are the cure, and medications. And so because of that, because they're clinging so tightly, how could they learn all this other stuff? Because you have to do what it is that I'm doing, and to learn about medication withdrawal and helping people, you have to admit to yourself that maybe you were wrong, and that maybe everything that you learned is wrong. And that's a big deal. I kind of equate it to the whole, like, you know, in the Matrix, the blue pill or the red pill, like you kind of have to take whichever one. I don't remember, but you have to take the other pill. It's a big deal. And so, yeah, that's what I think is kind of going on. And that's why I think it's going to be challenging to move this narrative.
So true. And I want to take it one step further when thinking about my own psychiatrist, when I tried to convince him and tell him, like, no, I'm in withdrawal. That's what's happening. He thought I had MS and you must have a brain injury. It was everything other than the meds that he prescribed me that was happening, you know? But I thought to myself back then, like, how could you sleep at night knowing that you harmed someone? You know what I mean? That is a huge leap. So not only did I learn things and I wasted my time and money, but I could have also hurt somebody. Like, that is a huge leap, I think. And I like to say, you know, when we do screenings and stuff, like, I'm not anti-doctor. I don't want to ever, like, I feel like doctors are also kind of a victim in this. You know, it's not just the patients that get hurt, the doctors are getting hurt too. And in a moral, it kind of like an ethical, moral way, like a moral injury.
And I have to say, I agree with you. And by the way, 99% of doctors and other healthcare providers are highly traumatized human beings, right? These are usually people who, when they were little kids, they wanted to help people. These were the people that, like, had big hearts and are compassionate. Like, there's, I know a lot of people think that, you know, doctors just do this for the money. Like, trust me, we don't do it for the money. Almost none of us do. And so we do it because we want to help people. So they go into the system thinking, I'm going to help people and it's going to be great. And then they get hugely traumatized by the entire process of the medical education, which is a highly traumatizing process, let me tell you. And get sold this myth and get brainwashed by the pharmaceutical industry. And then that's what comes out. So again, I feel the same way. Like, I don't blame them. You know, I think that, and it's so much of it too. It's just like this ignorance. It's just that you don't know what you don't know. And just kind of like we talked about not wanting to believe, you know, you believe that you want to help people. So to acknowledge that you've harmed them is really a big thing to do.
Yeah. Yep. It's a topic that I think about every single day. Like, is medicating normal really making a difference? Are we getting to the people that need to hear it? How do we make systems change? How do I get into UCLA to present at grand rounds? Like, it's like a huge part of our job on the medicating normal team. And it's really, 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 really hard. All right. So we have only 11 minutes left, which I'm super bummed out about, but I know you have to move out of your RV spot. And the campgrounds don't like that when you stay late. So I'll keep us underneath our time. But okay, so this question I know is going to come from the audience, but so holistic psychiatry and functional medicine are very expensive. And I know because I've tried it myself. But for the average person that's on a ton of meds, they're probably on disability. They might be in a HUD housing situation. And we actually get comments like this on our YouTube channel all the time. Like, I can't afford this. Like, there's nothing, you know, I can't afford a gym membership, or, you know, all these things. And myself, I'm a huge fan YouTube channels. Like I have learned so much from YouTube and it's free, you know. So from your perspective, like how does a person that doesn't have a lot of resources, accessibility, money, they might be in bed and just completely disabled because their meds are affecting them and they're in the middle of a taper. What do you suggest to those people to kind of begin their healing journey?
Yes. Okay. A difficult question. So one thing I just want to acknowledge too is that, again, being aware, bringing awareness to the fact that the reason that they may be, disabled and they can't get out of bed and all this is likely, maybe not just because of the medications, but the medications which may have caused a huge part, the harm that happened to them. And so, yeah, I mean, how sad that is to me, that we have, the system has harmed these human beings, and now are, they're at a point where they are struggling like this. I mean, to me, it's just, yeah, just want to acknowledge that. And then also, I just wanted to also just kind of say briefly that I despise that I know that it's not cheap to do a lot of the, some of the things, and I'll talk about that, but a lot of it, you're right, is very expensive, and seeing a holistic practitioner can be really expensive, and functional medicine. And one thing I'll say too is, so for example, like free range psychiatry, we do not accept insurance. And I know that really makes it hard for a lot of people. But for example, the reason that we don't is because they won't pay us to do this, right? The insurance companies. So it's, again, the whole system is broken. It's not just like, and I want also maybe for some viewers to understand that too, that like, that's why a lot of the functional and holistic people are out of network. It's not that we don't want to take insurance because we don't want to help people. It's because we can't, because the insurance companies don't want to reimburse because of the broken system and the pharmaceuticals and all that kind of stuff. So all that being said, it is really difficult, and it is a lot to go through. One thing that I also want to throw out there too is that, I hate to say this because I don't want this to come off as like that that I don't understand, like when money is really a challenge, but it is something to think about, that the things that you are doing, like in the holistic model, a lot of times they may be more money up front, but I can guarantee you they do save money long term. And this doesn't help somebody because you're like, well, wait, if I don't have the money up front, like I can't, why are you telling me this? But I just want to just the reminder, like, I mean, I know this for myself too. Like I will, spend some money that I have to spend to get the extra thing that I know that's going to help me. And guess what? I haven't been to a doctor in many years. I don't have to, pay for prescriptions. I don't have to pay for hospital visits or doctor visits or any of that stuff. Like I save all that money because it's, kind of doing it up front. Again, I know that's not helpful if you don't have the money up front to invest. So I think one thing that I would say is that, I guess how important, that there are a lot of things that can be done, that are, like you said, we're talking about the YouTube videos or something. There are a lot of things out there that are like free or very cheap. And I think maybe something that's important to remember too, is we kind of think that, again, like we've been sold this story that to get a cure or whatever, like it's going to be this expensive thing, and it's going to be something outside of myself, right? I have to find this healer. I got to find the right brilliant doctor who can fix all my problems or whatever. And I've got to pay them $1,000, right? The thing that I have learned, and this is what I have learned on my own healing journey, like 1,000 times, and in doing this process, working with so many different people, is it really is an inside job. And I know how hard this sounds. Like, I know that this can sound like, when you're in the thick of it, when you're feeling just absolutely overwhelmed and anxious and depressed and you can't get out of bed, to hear, oh, well, she's just telling me that, it's, I got to do it all on my own. And I know that's hard. And that's not exactly what I'm saying. I'm just trying to say, I guess I believe in like a empowerment model. So it's not like a blaming, but it's just like the knowledge that everything that you need to heal is actually like I know this sounds crazy, but like you can literally do it for free, like in your bed, like with nothing else, like, and all of the information about how to do this. And I know this sounds crazy, but is like in your body, and your body is trying to tell you, like it's trying to push that information. It's just about the process of kind of like listening to it. And again, I know I'm saying all this, and I'm not trying to, I know how difficult all this actually is. But there are things like the type of things that I would recommend is just like you said, like there are like tons of free YouTube videos. There's also a lot of like books that you can get for like really cheap, by the way, like on Amazon or one of those. I mean, you can get used books for like $1. And there's a lot of great books and things like that and resources that are out there. And then just like, I think that like, as far as like the things that I would recommend kind of, I guess I'll come back to the importance too of that support system. And I know it's really hard when you're sitting there scared and alone and you don't know whatever, but if you, even if it's going to a forum or like I'll talk about, you know, some support groups that we have, but just anything, any place, even if you can't get out of bed, like there's, you know, there's no excuse now because you do have, as long as you have an internet, but if you don't have internet, it makes it challenging. But if you have internet, there's forums out there, there's places, there's people, but like connect, right? That's the thing. And then if you're able to get out of bed, I know this may sound like crazy, but I know it won't sound crazy to you, but like literally get out of bed, find a patch of grass somewhere and lay in the patch of grass. And I know this sounds like, okay, that's crazy. How could that actually help? But it can do so much. Just what's called grounding, just connecting to the earth. I promise you, like miracles happen. And even if you can only do that for like 20 minutes a day, and even if you can't even get outside and walk, but all you can do is just like lay there for 20 minutes in a patch of grass, it will help. Right. And so that's free. And you can, you know, it's hard, but you can do it. And then there's a lot of things like there's all kinds of, my two favorite things, like kind of to help people are yoga and meditation. Meditation wise, there are tons of free apps out there. My favorite, if you have a smartphone, is Insight Timer. Insight Timer, you can also do a paid subscription, but it's free. Oh my God. And you know, meditation is also, again, one of those things, you just lay there in your bed. Okay. Like if you're going to be laying there anyway, why not lay there and also listen to some beautiful sounds or listen to a guided meditation or something like that? I could talk for years about like the benefits of meditation, but they are profound. I promise you. And if you have enough energy, like I said, there are a bazillion free yoga stuff like on YouTube and things like that you can do. Yeah. And I'll say this too, just to talk about, you may just to transition for a moment also to free range, is that we understand that this is a big challenge, that a lot of the people that need us the most are the people that may not be able to afford our full services. So we do offer, we do have scholarship positions available. I wish we had more than we have. If we you know, get more revenue in the future, we'll have more of those available. And then we do have some free stuff that's on the website and more stuff that's coming soon. In fact, we're about to launch this really cool program. I won't talk about it now, but that is also going to be available. And then do you mind if I talk about the support groups here too? Okay. Please. Yeah. So we also have, so we launched this virtual support groups. So it's a subscription. And so right now it's available for $15 a month, which is, I think, pretty doable for most people. And we have 5 groups right now. So each group meets weekly, and the different ones are like trauma. We have one on eating, one on anxiety, mindful living, and I can't remember the other one. Yeah, I can't remember. Anyway, you can go to, so basically you would be able to go to 5 hours of group, you know. The other one is the medication withdrawal. So we have one called Psych Med Warriors, which is specifically for people who are coming off of psychiatric medications. So even if you don't do anything else, if you just, you know, can't do anything else, but you attended like that, you know, 5 hours worth of those groups per week, like I can guarantee you it would be like transformative. And back to what I said about how important community is, how important connection is. Like if you do nothing else, like just connecting with other human beings. And I can tell you that the types of people that are in these support groups, and definitely the one called Psych Med Warriors, are just like other beautiful human beings that are going through this exact same kind of thing. And there's so much to be said for, you know, finding people who are going through something like you're going through.
Amazing. Yeah, I want to make a point here really quickly because I know we got to go. We get a lot of emails all the time that people say, I need a doctor to help me. I need a program to go to. And same as you, I feel callous when I say and it's, I still haven't found the correct words to say it in, but it's like, that's part of the problem, that we bought into, that there's somebody external to us to help us and to take the meds away, and there's a program to go to. And unfortunately, I mean, those programs don't exist, and those people are very few and far between. And so it's hard for me to tell that to someone, because they haven't quite reached that, like, it's an awakening that you have to kind of learn the hard way. Like, wait a minute, that's what I was bought and sold, that there's something wrong with me, there's somebody that's going to fix it, there's a magic pill to take it away, or a program. And it's like, that is not, it's hard work. It's extremely hard. And then the other point I wanted to make was, like, in my own journey, I'm 6 years off of everything, but I was like so traumatized by that system that I became like anti everything. Like, I just want to be a human being, and I just want to be who I am, with all my feelings, my messy emotions, my bad diet, my poor sleep hygiene. I'm just going to be who I am. And it is what it is, you know? And now I'm starting to come to that point where I'm like, my whole life needs an overhaul, because I'm not done. Like, I'm not healed. I still don't feel my optimum best. Like, I know I could feel better than I feel. And so kind of what I did that's free was that I just went on YouTube and listened to podcast after podcast. And I just completely absorbed myself into like things about sleep. You know, Andrew Huberman's podcast is freaking awesome. I wish I could get him on this, about neuroscience of like sleep and metabolism and diet. I mean, he has so many amazing things. It's all science-based and amazing. So I've realized, not only like in the mental health sphere, that like your symptoms are telling you there's something going on here you need to look at, there's a way to fix that or whatever, that like everything is also connected. So like the way I slept last night affects the way I eat today. And what I eat today is going to affect how I sleep tonight. How much sunlight I get in my eyes is going to affect how I feel today. If I lay in the grass or not, like everything is connected. And just like the human body, it's all, there's no siloed anything. So I guess let's leave on that note. Like, can you talk about, well, because I'm sorry, I'm so scattered all over the place, but like your feed on Instagram with all this beautiful, delicious food, it's like, it inspires me, you know, like to eat a little better and go to the farmer's market this weekend. So I think I want to leave on the note about RV living, because we are, and you're just getting started, but I'm 2 years into RV living, and it's literally immersed me into nature. And when I go stay in a house of a friend's house, or I go stay in a driveway, or I drive through traffic, it literally gives me anxiety now, because I'm like, I can't live in this way. I have to live different for me to feel decent. You know, like that is my medicine, like being in nature, having the sunlight hit my eyes. So kind of like, what does holistic living look like? Like how much work goes into this? Like, what is the ideal way that we should be taking care of ourselves, opposite of the way we were taught?
And yeah, that it is the opposite of the way we were taught. That's what I have found, is almost everything about our society and the way that we live is kind of going against us. From what we eat to where we live to how we do everything, our schooling, everything is kind of against our nature. And so that's what I would say, is that a holistic living and kind of all this, what it means to me is to really get back to our roots, to get back to nature, to get back to being connected. And it's just like you were saying, where you were talking about how if there's one myth that I could bust, it would be that whole model of like, go to the doctor knows best, and fine, you have to. No, we have the word that we use is guru, which means like teacher. So we have this guru within ourselves, a teacher within ourselves. We each have an infinite source of wisdom. So when we're born, we have kind of like full access to that. And that's why kids are just so brilliant. You don't have to ask kids like how to be happy or how to play. No, they just know how to do it, right? They're in touch, right? They're completely in touch. So what happens is, as we get older, society and everything else teaches us, again, to be disconnected, that disconnection from our intuition. So more than anything, I think it's about following that intuition. And so what holistic living looks like for me may not be the same as what it looks like for everybody else. So more than anything else, it's don't listen to me. I'm not the guru. You're the guru, right? Listen to yourself, listen to your own body, find out what works for you. Like, not everybody, like, you know, when I talk to people about what they're eating and things like that, it's not all the same. Like some people could eat one thing and they feel great when somebody else might feel horrible. And I can't tell you, again, I, as the doctor, can't tell you which thing. It's, you know, you have to have that experience for yourself. But for me, you know, it's definitely like the basics, which are getting, like, you know, when I said disconnection, I forgot to mention disconnection from nature, disconnection from the earth as being another one of these big things. So I have to go outside for at least an hour every day. If I do not, I can't function very well. So spending lots of time outside is important for me, and following the things that make me happy, right? And not being afraid to do that, and not having to feel like I have to ask permission. So for example, leaving behind a house and a stable life and going full time with 2 little children in an RV, which could sound very, very crazy and unwise to a lot of people. But I was following my heart, you know, and that's what I needed to do, like to be happy and healthy and really live the life that I want to live. That's what it meant. So you have to remember that following that inner guru, following that wisdom may mean that some people may look at you like you're crazy. Some people may like question what you're doing. Yeah, exactly. Who cares? You have to just be willing to say, I'm just going to tune all that out. Like, you know, society and television and Facebook and your parents and your teachers and everybody else, like none of them know what's best for you. You do, right? And you're not, you know, at least it's my belief that we're each here on this planet to like be the highest, you know, our highest authentic selves, right? And I think if we try to be somebody else or follow the path that somebody else wants us to follow, we're always going to, it's never going to work out, because that's somebody else's life. And, you know, but again, going back to that, just, you know, going outside, getting sunshine, connecting with other human beings, smiling, laughing, eating food that feels nourishing to my body as much as I can. Sleep definitely is a biggie, getting enough sleep. And just, I think the other biggie would be like, you know, doing something creative every day. Like for me, so like, just even if it's something like posting something to Instagram or like just whatever, like singing, laughing, dancing, just something like creative and something that allows me also to be in my body. So whether that be dancing or running or yoga or whatever, something that, you know, we spend all of our time up here in our heads, right? And so there is magic and wonderful and so many beautiful things that are healing to be found when you come into your body. Because you can't be into both, right? You can't be like freaking out and thinking about 1 million things and also kind of grounded down here in your body. And so once you do that, once you bring it down to your body, there's so much goodness there. Yeah, I could talk about this for hours, but I think I'll leave it there.
That was awesome. Okay. Yeah, I feel like we need a part 2 maybe, because I feel like we barely scratched the surface. We didn't have time for any audience questions, but you mostly covered them. So I'm going to leave them at that. But there's a lot of thanks for everything that you do in our comment section. I want to thank you. I think you're leading the edge of this paradigm shift, and I just fully support you. And we at Medicating Normal fully support you. And you know, if there's anything we can ever do, please just keep being you, because it's awesome. And everything that you guys are doing is awesome. And I just a huge supporter. Thank you everybody in the audience for tuning in. I'm going to leave it at that. If you want resources, alternatives, a reading list, everything like that is on our website, medicatingnormal.com. And Nicole, my outreach partner, has put all the links to free range psychiatry and the support groups and the fellowship and everything. It's in the comments. If you're watching this later on YouTube, please subscribe, but it's all in the comments or the caption of the video. Thank you so much and enjoy your journey. Where are you at right now? I got to hear.
I'm in Knoxville, Tennessee.
I am in Grafton, Illinois, population 550.
Awesome.
Cool. All right. See you down the road. Thank you, everybody.
Bye.